And in Ohio, deaths due to COVID have increased 70% in just the last 2 weeks. Joining me for more on this is Chief Medical Officer from Dayton's Children's Hospital in Ohio, Dr. Adam Mezoff. These numbers are just astounding, Doctor. You know, Ohio reaching an average of more than 16,000 cases per day, we have learned. What do you think is going on here, and what are you seeing specifically there at Dayton Children's Hospital?
I think that the surge that we're seeing has obviously played out differently in different areas of the country. What we're seeing in Ohio is in some ways regional as well. So the northern part of our state had their large surge, and that seems to be improving. Our part of the state, which is more the southwestern part of the state, we're still peaked with the numbers that we're seeing. From a children's standpoint, at the end of December, we had 5 patients in the hospital with COVID. In the past week, we've had between 20 and 30 patients a day with COVID.
And what are you find? Is it the unvaccinated? What's driving these numbers, you think?
More than 95% of the patients that we admit to the hospital are unvaccinated. However, many of them are less than 5 years of age, and so they have not been eligible for vaccines.
Okay, got it. Wow, that just impacts, you know, how we want to see the vaccine moving when you see these kind of numbers impacting kids under 5. So then what happens when you've got such a high number of kids seeking care for COVID and even other things, but the hospital systems are overwhelmed? How are you dealing with this and compensating for that?
We're fortunate in that the children's hospitals, while having huge volumes, have been able to manage those volumes. The state of Ohio has a very close-knit group of children's hospitals, so we lean on each other to help each other out when the times get tough and when we need that sort of help. But we have been fortunate through the incredibly diligent and hard work of the folks that work at our hospital, while being short-staffed, still being able to manage the volumes we're seeing.
Well, that's incredible that you're able to do that. So your advice here, your need, this is your chance to talk about it, just the tools that the state should be making more available to you. What if you could get the ear of the right person right now, what is it that you need to deal with these numbers that you don't have, that you're struggling with right now?
I would say there are maybe 2 things that I would focus on. First is that while temporary, continued masking in schools will help decrease the spread among school-aged kids. And so I think masking is a strategy that we ought to continue to pursue. Secondly, if I had that magic wand that you're alluding to, I would love for everybody as a community to get together and say, to protect our children and each other, we're all going to get vaccinated. While we may have some different views on whether or not to get vaccinated, if it's in the best interest of our community and our children, I'm going to go ahead and do it.
We're listening, and it's good advice. Dr. Mezoff, appreciate your time today. Thank you so much.
Thank you very much.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.